Thank you very much indeed. And it's not often that a health secretary gets invited to the British Chambers of Commerce. And I don't think you've invited me here because of my reputation as an app developer. But I wanted to talk today about the coronavirus and the contribution that British business can make to helping us as a nation to tackle it. But I also wanted to say what a huge honour it is to address you today, to address this conference. For a pro-business conservative like me, the keynote speech at the BCC is a bit like being asked to play at Lord's. This organisation speaks for British business, and in my belief, speaks for British business so well because it is so firmly rooted in communities. I know that because my mum was a member of the local chamber up in Cheshire, and I still remember the first time I heard about the concept of a Chamber of Commerce from her. And your brilliant chair, Sarah, was until recently the chair of my local chamber in Haverhill in Suffolk. Before I turn to the coronavirus, I want to say something else as well, which I think is very important and important that we always hold on to and remember. I want to say something about why I believe in business. We hear about this sometimes. But sometimes we hear too much about it in a functional, practical way. That's important, but it's not just about the jobs that you create. It's not just that I'm deeply mindful of who pays the taxes that fund the NHS. It's more than that. It's that business, done right, is a force for good in the world. Because great businesses ultimately succeed by solving other people's problems. Look at the life sciences, the area that I'm most directly responsible for as Health Secretary. Just recently, I announced a deal with Novartis that'll mean the NHS is among the first in the world to access a brand new cholesterol-lowering drug at scale. This is a twice-yearly injection that can prevent tens of thousands of heart attacks. Life sciences, the clue's in the name. They save and improve lives. And business done right is a moral force for good because it links effort and reward. It's about something for something. For me, this is really personal. I grew up watching my parents battle against the odds to build a brilliant software business. And I know what the challenges feel like. In the recession of the early 90s, we almost lost everything because of a late payment problem. The business was strong, orders were coming in, but we were literally one check from going under. And I remember the feeling of injustice, that everything they'd worked so hard for was on the line, all because of a problem that was not of their making and was outside their control. Now, fortunately, the check came through and the business went on to thrive. But that experience is engraved on my heart. And in politics, I've always worked for economic security as the foundation of everything else. Because I know, like you know, that the economy is not just numbers on a spreadsheet. It's people's hard work and livelihoods and dreams. Right now, leading the healthcare system's response to the coronavirus is, of course, taking up the overwhelming majority of my time. But I'm very conscious that over the last few weeks, small businesses across the country will have been listening to the news and worrying about the future, something outside their control. So let me turn to the biggest near-term challenge facing British business. Our approach to tackling coronavirus is to prepare for the worst and work for the best. We're basing our preparations not just on the most likely scenario, but on the reasonable worst-case scenario. This week, no doubt you'll have seen, we published our 4-part action plan to contain, delay, research, and mitigate the virus. That plan is driven by the science and guided by the expert advice of the Chief Medical Officer and others. Contain, the phase we're currently in, means detecting the early cases, tracing their close contacts, and preventing the disease from taking hold in the UK for as long as is reasonably possible. This approach has bought time for the NHS to ramp up its preparations. But the scientific advice is that we may not be able to contain the virus forever, especially if the number of cases continues to rise in Europe. At that point, on the advice of the Chief Medical Officer, we'll activate the next phase of our plan, which is to delay. This is about slowing the spread, lowering the peak impact to push it away from the winter season when the NHS is under maximum pressure. I will always prioritise protection of life, but we will seek to minimise the social and economic disruption too. Because the scientific advice is very clear that going too far or too fast carries risks of its own. Ultimately, we're working to a timetable that is set by the progress of the virus itself. With 85 confirmed positive cases in the UK, shutting down all our schools and universities, for example, would not have a clinical benefit at this stage, but it would impose huge social and economic costs. So we will follow the science. And that brings me to the third phase as well, which is research. Research has been ongoing ever since the moment that COVID-19 was identified at the end of last year. We have some of the finest minds, finest scientific minds in the world working day and night on a vaccine. But we do not think that a vaccine will be available in the coming months. And just as important is research to understand what currently available drugs and treatments might help those who are already sick. I'm incredibly proud of the team at Public Health England who were among the first to sequence the genome of this virus. And I'm also incredibly proud of the role that British businesses like Oxford Nanopore have already played and are playing in, for instance, providing the testing kits used around the world. We could not do this without you. If coronavirus does become established in the UK population, we will only be able to delay widespread transmission for so long. At that point, we'll move to the mitigate phase of our plan. This is about focusing our resources as a nation on supporting those who are most seriously ill and keeping essential services going at a time when large parts of the workforce may be off sick. And you may have seen some of the estimates in the plan that we published on Tuesday. We have a range of options to support business, to support supply chains and the wider economy should the situation require it. I know that the Business Department and the Treasury are thinking very hard about how to do this in the budget next week. I know the hit that many businesses are already taking. I understand the sense of trepidation that something outside your control is such a looming risk on the horizon. I will do everything I reasonably can, not just to protect business, but to help business through. This is going to be a difficult time for us all. What I can offer is transparency and support and a rational, science-led approach. And I know this, not least because I started my life surrounded by small business. We in government can't do this alone. Tackling coronavirus is a national effort. As UK businesses, you have a crucial part to play in helping us respond. First, we need you to engage with us, keep talking, so that we can incorporate your views into our preparations. Second, we need you to stay informed. We've published specific guidance for employers on gov.uk. It tells you what to do if someone in your workplace comes into contact with COVID-19, along with advice for responding to it. Third, and most of all, we all need to support our employees to do the right thing, including to self-isolate if necessary. Yesterday we announced that we'd bring forward measures to allow the payment of statutory sick pay from the first day that you're sick. And many occupational sick pay systems already do this. Our principle is clear. No one should be penalised for doing the right thing and following the official medical advice to self-isolate if they test positive. It's in your employees' interest, it's in your interest, and it's in the national interest. And one of the things that this teaches us is that health and work are umbilically linked. It's a lesson that we can't afford to forget once we get through this. Yes, of course, you need a strong economy to pay for the NHS, but a strong NHS is good for business too. Healthcare that's always there for you, unconditionally, supports a risk-taking entrepreneurial economy. And increasingly it's recognised that the nation's health is not just the NHS. We know that around a quarter of what leads to longer, healthier lives is the result of what happens in the health service. A quarter. The rest is down to genetics, the environment, and the lifestyle choices that people make. And businesses have real influence, especially over the last two. A job that's purposeful and rewarding is good for your health. And almost by definition, employers have a chance to intervene much earlier than the NHS. We all need to play our part. So, mental health support, musculoskeletal support, bike racks and shower facilities, flexible working, support for healthy eating. These are not business costs, they are investments, just like your investment in your skills and training budget. So after this epidemic, I think we need to bear down on the $9 billion a year lost to sickness absence. And it's one big part of how we can deliver on our long-term goal of 5 extra years of healthy life across the population as a whole. So whether in good times or bad, we are not powerless. We are not powerless in the face of this virus. We have the best minds and a clear plan of action. Everyone can do something, even if it's as simple as washing your hands more often. And in the coming weeks, it will be tough, but with calm heads and clear determination, together we can see it through. Thank you very much indeed.
Thank you.